Good morning, everyone. Sorry for the rough start. I know it's a bit early. Thank you for being here. I'm Gannon Sungar. I am one of the co-chairs of the Medical Student Symposium, along with Nick Mon. I'm also one of the associate program directors for the Denver Health Residency in Emergency Medicine. Nick is the Med 4 director at Ohio State, so involved in a little bit more on the medical student side. And so we tried to create a program today that offers kind of the transition. And we'll talk a little bit about what this day is going to look like, and then we'll dive in. We have some really, really amazing speakers today, so thank you for being here. So the Medical Student Symposium has kind of evolved over the last maybe 5 or 6 years. In the past, it was a lot about clinical topics, how to succeed in emergency medicine, how to take good care of patients. And really what it's morphed into in the last couple of years, and this is largely due to Nick and you can blame us, I should say, is really trying to walk the path of a successful transition from where you are now as medical students to where you want to be as residents. And I know we probably have students across multiple years of training, but ultimately the goal is to get you into the residency you want to be. And the goal today will be to kind of show the path to get there. So to really drive home this analogy, this is a map of New Orleans. New Orleans can be a disorienting city for a couple of reasons. And so we're going to say you're at Cafe Du Monde enjoying beignets, maybe after a couple drinks, and we want to figure out how to get you safely back to your hotel. And so we're going to walk this path today, and we're going to discuss a number of topics. We're going to talk about mentorship. We're going to talk about clinical rotations, sub-internships. We're going to talk about your personal statement, your SLO, your ARIS application. We have a 40-minute session today on preference signaling, which will be a new addition to the emergency medicine match this year, which I think is exciting. And the ultimate goal is to get you all the information you need to be where you want to be and successfully match. Here's our objectives. We won't belabor these too much, but the goal again is to walk through each of these components. This is the schedule. Like I said, we have some really fantastic speakers, people who really live this work, and so take advantage. I think the other thing I would say is we're lucky enough to have a number of faculty in addition to our speakers who will be here for lunch. And so we'll have a lunch from 11:30 to 12:30. We'll kind of spread out, and you'll have an opportunity to kind of informally chat with program leadership from across the country. Just to prompt you, we will kind of interrupt that lunch about halfway through and allow you the opportunity to change tables, just an opportunity to get you all a little bit more face time with different program leaders. You're welcome to stay put. Nick and I were just saying that we've done this a couple different times, both virtually and in person. This is actually a great room and a great crowd. And so it's a little bit smaller, it's a little bit more intimate, and we encourage you to ask questions, to engage. We're going to have some break time, but feel free to come up and chat with us. We really want y'all to get the most out of this day as possible. Lastly, this is a QR code. You don't need to grab it now, but it's going to be flashed throughout the session today. This is kind of a summative evaluation of the sessions that you attend and the overall programming of the event. We want to make this good. We want to make it better next year, so please provide us the feedback we need to be able to continue to deliver kind of the best content that we can. And with that, we'll move on and get started with our programming.
And as we do that, so just to kind of learn who our audience is a little bit, raise your hand if you're a Med 4 going into residency. So yeah, probably not a lot there. So raise your hand if you're a rising Med 4, so Med 3 transitioning. Okay, almost everybody. Raise your hand if you're a Med 3 starting Med 3. Okay, a couple. If you're a Med 2, any Med 1s? Oh, thank you. There's only one, but you're a way ahead of the curve. So some of this may change even before you get to this time, but well, thanks for coming, guys. I think it's a good crowd. I think most of you obviously are here, as you start the residency application process, which is, probably the audience this is built more for. So, all right.